This is another SciTech Report.
So we were very deliberate during the first 3 years of Medipacs, from getting the technology from the science bench to an engineered actuator that we could put into pumps. Now we get to come out with our first product, which is a veterinary product. This will hold 5 cc's and it will deliver that 5 cc drug load over a 24-hour period, meeting the needs of post-surgical veterinary operations.
Most of the time when people come here, they are frantic, they're in distress because their animal, has suffered some sort of trauma or illness. So it's typical for the owners to come running in. That's when we will go up front, take the animals to the back, and have them seen by our doctors right away.
The clients really want their patient to be comfortable after surgery, and when you have an animal that's had multiple traumas or fractures, pain control is just essential.
And a lot of times you're sending home pills with a owner, and if you've ever had a dog or cat and you've tried to get a pill that they don't want to take down their throat, it can be quite a experience.
Managing that pain after they've initially been treated, it's very important because our clients want to know that their animals are being taken care of and they're being comforted.
I like the idea of having a send-home pack that you can use with a constant rate infusion of multiple analgesics. It really gives us the flexibility of using medication that we normally can't use at home.
The owner will be able to know that their pet is getting the drugs administered safely.
Clients come in, they like the fact that the animals are at home, and we can change out the Medipacks and put a new amount of medication.
You could provide a higher level of medical care, or better grade of medical care, because you can have some control over what's going on with the animal. You can monitor the animal much closer.
You can administer not just pain meds, but they can start using it for anti-nausea meds, or any of the things that traditionally are very hard to administer to a pet.
This is going to be a great product for everyday use, especially for the animals that we see. So not only would every animal that has had surgery or some sort of recovering from a traumatic event benefit from the vet PRN, but I really think it's something that all of the practices in the area can adopt, anywhere from regular day practice, who are still doing your spays and neuters, to Angel Care, who's doing oncology and radiation.
It's going to be much easier for the customer to be able to go home and know that their pet is getting the medication that they need and getting the comfort that medication is providing.
I just like the flexibility of using different medications that I just couldn't use before.
It's a great technology because it's customizable. The delivery can be customized to the person and the drug delivery, and also it's very inexpensive. Most of these devices will be disposable devices.
After surgery, after we've set a leg and put it in a splint, after we've sutured up all the bite wounds, after we've removed a spleen, there are so many different instances that we would use the vet PRN.
So this gives an option where you can administer a drug safely for the owner and safely for the animal. I think it's going to revolutionize that delivery of drugs in the veterinary market.